I'd like to introduce Mr. Frank Wooley, our Executive Secretary. He, too, is one who has done his homework exceptionally well. He has a deep devotion to and faith in God, America, and individual responsibility, and in that order. I want you to meet Mr. Frank Wooley.
Thank you, Dr. Dorrity. Fellow patriots, the doctors you have just heard are leaders from throughout the country who understand and live by the principles that underlie the success of Western civilization, and particularly the United States. They are for the private practice of medicine on a fee-for-service basis without compromise. They have told you why political medicine is bad medicine. Also, why the system of private fee-for-service medicine as practiced in the United States has resulted in the highest quality medical care for the most people of any country in the world. You can get printed copies from us of the case against nationalized medicine, which refers to many of the ideas discussed here this morning. It is entitled Medical News from Washington, D.C. Dr. Ramsey, if you and some of our colleagues who are in the room would distribute that article now, the people would be able to take away in printed form the basic ideas that have been discussed here this morning. Now, when you get it, you will find it includes a summary of 6 leading nationalized medicine bills pending in the Congress at this time. It includes an analysis of the Kennedy bill, the legislative proposals of the American Medical Association, the Nixon administration, the American Hospital Association, and others. Former Secretary of Health, Education, and Welfare, Wilbur J. Cohen, a leader to collectivize United States medicine, has set forth 10 standards for measuring the desirability of federal intervention schemes. You will find in this medical news report Mr. Cohen's standards and how each one of the pending proposals fits his requirements. All proposals now pending in Congress meet his first principle. His first principle is, quote, breaking the barrier between paying for health care and eligibility for services. This standard is an innocent appearing way of stating the system in the United States of paying for what you get is to be destroyed. Miraculously, Mr. Cohen would have everyone receive medical services without paying for them. You will be interested in the terse analysis in this paper of the many complex proposals before the Congress. As a matter of fact, many of these bills have complicated language that will run to 400 and 500 pages. They even confuse those who are attempting to confuse others. You will see from this analysis that a large segment of freedom in America is being systematically attacked by people who do not believe in or are confused about voluntarism, individualism, and a willing exchange economy. However, if our system is to be saved, it will be because people like you who cherish it go out and work for it. There's no easy way of doing the job. You will also have distributed to you, before I finish with these comments, a white paper which we invite each one of you here and now to fill out. It is my fervent hope that no one in this audience will go home and say that they heard a wonderful lecture on the life of Christ by Dr. Schenken and some incisive comments by a group of physicians and surgeons who are dedicated to the freedom of the individual, and go home and say that it was a wonderful meeting. My hope is that when you leave here, you will not look back, but you will look forward and not complain about what other people are doing, that they're asleep and that sort of thing, that they're apathetic, but you will say to yourself, here is what I can do. This white paper that is being passed out, on one side is a list of actions that you can take to stop political medicine in America. It is divided into two parts. First, what can you do to help? Such as the ordinary things: write your congressman, write letters to the editors, and ask your doctor what he is doing to avoid political medicine. The second part is an order form through which you can get information from the Association of American Physicians and Surgeons, which you can use to help in this struggle. For example, the association has a series of leaflets for patients which answer false charges against our system, such as doctors are responsible for skyrocketing costs. Of course, the facts are inflation induced by excess government spending, skyrocketing taxes, and unbelievable government red tape are primarily responsible, not doctors. It exposes the claim that politicians will provide more health care for less money. Samples of these pamphlets and other material were shipped from Chicago, but Murphy's Law being in operation, since we have Dr. Quinlan with us, the material did not arrive. It's someplace lost out at Logan Airport. And search as we might, no one could tell us where it was unless we could tell them the bill of lading number and everything else, and the bill of lading number is not available over Sunday in our office. But Dr. Albert S. Anderson of Pittsburgh, Massachusetts, has a desk out here where he has considerable information which will be of interest to you, and also Dr. Ramsey has, as always, some material which you will find of interest. The association has prepared a catalog of various pamphlets, tracts, and this catalog will be available, made available to you by some method, now that it isn't here. And by filling out an order form, you can get what we have in that catalog, which can be used to explain why political medicine is bad for patients. With these, you will be armed to help spread the truth about political medicine. At times, we despair that the truth is being smothered by political propaganda. Nevertheless, politicians, even those in Massachusetts, generally tend to find that spot where pressures equalize. If enough people begin to speak the truth in any political area, politicians, being the souls that they are, will have second thoughts about being identified with legislation that flies in the face of the truth and all of the facts. By telling us what you will do to help in this campaign, both of us can get better organized to cooperate with each other to inform the public about what is going on. Now, on the reverse side of the white paper is an opinion survey which we invite you right now to fill out. We want to take something away from this. We want it to be a beginning, not an end. It concerns your attitudes about converting our present voluntary medical care system into one of compulsion. Please go over this with me now and fill it out so that we can have the benefit of everyone's opinion at this meeting. If you want additional copies to take home with you, to turn over your friends, let us know, and we will supply them to you. Now please turn to the opinion survey on nationalized medicine. Do you all have a copy? Does anybody need a copy? No one needs a copy. All have a copy. The first question is, should federal governmentally financed medical care be expanded to include all Americans of all ages, regardless of need? Please check the square which represents your opinion. No, yes, or no opinion. That, by the way, is the bill that has been prepared by the advocates of socialized medicine in the United States for over 30 years. It includes such people as Woodcock of the UAW, Wilbur Cohen, the labor union leaders, the socialists, their communist allies, and they're speaking through and using as a mouthpiece a young person who happens to be in the Senate from the state of Massachusetts. The second question is, should the federal government be encouraged to intervene in the financing of medical care on a bit-by-bit basis so that if it isn't socialized medicine proper, it paves the way for socialized medicine? Again, please check your opinion. That question was formulated from a pamphlet put out by the socialists entitled "The Case for Socialized Medicine," and quotes precisely how they intend to bring about nationalized medicine in America. Number two, should the federal government be encouraged to intervene in the financing of medical care on a bit-by-bit basis so that if it isn't socialized medicine proper, it paves the way for socialized medicine? That's what the socialists say. This is the Fabian tactic of the inevitability of gradualism. Gradually push it in, Medicare, Medicaid for the old. Now they're talking about child care for the young, and then they're going to talk about the middle-aged because the old people are getting it, the young people are getting it, so therefore the people in the middle ought to get it. They'll get it if they follow the politicians. The third question is, should the predominantly voluntary, willing exchange system of private personal medical care on a free-for-service basis in the United States be changed by the federal government setting standards in a way financially favorable to cooperatives and group medicine, mainly salaried and impersonal? currently called HMOs. There is a bill now pending in the Senate, H.R. 1, which calls for prepaid, per capita, group practice medicine. They have been agitating for this ever since the 20s. It is the main device for imposing nationalized medicine in America. The present administration has euphemistically named it health maintenance organizations because they think the people are so stupid they can't see through the chicanery. This is the legislation that's now pending. Please check the appropriate square with respect to this. The fourth question is, yes, it passed the House, and the Senate Finance Committee has just finished marking up a bill that constitutes about 500 pages, and about 400 of them talk about the benefits. It talks about what they're going to do for everybody. It does not explain in plain English what they're doing to everybody. H.R. 1. The fourth question is, should medical societies become paid policemen for the federal bureaucracy to control patients, hospitals, and doctors regarding admission, length of stay, and discharge from hospitals, and regarding physician diagnosis and treatment of patients in or out of hospitals, all in subservience to government regulations based on political considerations? Again, please indicate your opinion. The fifth question is, how do you evaluate the quality of private medical care that you are now receiving? Please check either excellent, good, fair, or unsatisfactory. The sixth and final question is, what do you consider most important in your physician-patient relationship? Please rank by number. Fine medical training, skill, and experience. That's one of the alternatives you could check, or number. Second, personal responsibility to you, the patient. Third item, more time with your physician during office visits. And fourth, reduction of usual and customary fees. Thank you very much for filling out this form. If you will sign your name and address and turn it in as you leave the hall, we will summarize the replies and send them to all of the senators and representatives in the United States Congress. And we will tell them that this represents a group of people from throughout the country who believe in God, family, and country. We welcome all of you as allies in this phase of the struggle for freedom in America. You people here today know that throughout history freedom is rare and slavery the general lot of the human race. Our forefathers understood independence, and we have enjoyed it because they were willing to fight and die for it. The vicious hand of government tyranny through spending and control is reaching out here as well as elsewhere to destroy independence. You and I know that the only way we can save our independence is to expose the schemes of those who would enslave us by clever appeals to humanitarianism. The Association of American Physicians and Surgeons believes in independence and invites all of you to assist us in defeating legislation which, if enacted, could well destroy the independence of all of us, patient and physician alike. I thank you.